That was a picture of the queue, and it is going to be packed tonight for the Chargers and Broncos game at 5:30. Well, if you or anyone you know has ever suffered from migraines, you know you will do anything to make it go away. But instead of popping pills to treat it, relief could be just around the horizon with something you put in your mouth. That's not a pill. Dr. Hornberg says you can give your brain a break with something that is just as easy and small as this little guy right here. Thanks for being here today.
It's good to be here. Thank you.
So NTI is what we're talking about.
Right.
And you're going to say the word, what it stands for, because I can't possibly say this.
It's nociceptive trigeminal inhibition.
Wow.
And what does that mean?
Yeah.
Well, trigeminal is the nerve that actually it controls and it innervates our jaw muscles, our nasal passages, our brain, around our eyes, and nociceptive is pain. And so if we can inhibit the pain caused by that trigeminal nerve, then we eliminate a lot of the problems we have in the head.
So people, if they're having pain in, headache pain, any kind of a pain, we're so ingrained in our society to take medicine. How are you shifting for people to get the word out about NTI?
Well, I think it's important for the physicians to kind of get on board as well. Typically medicine, and dentistry to some degree as well, tends to treat the symptoms instead of the cause. And what we've seen with headaches and facial pain and even some nasal pain and eye pain is associated with the muscles that we chew with. And most of our migraine pain and our head pain, it's caused by people clenching at night.
I can totally relate to this topic because for years I would get these really bad sinus pains that felt like an elephant was kind of, sitting on my face. My doctor said that they thought that it was from clenching my jaw, and I did physical therapy on my jaw, and my sinus pain went away.
Yeah.
So this can act in a really similar fashion.
Absolutely, and it's interesting you mentioned about the sinus pain, because lots of people, they'll have almost like a sinus infection type symptoms, where they'll have a runny nose and swelling and pain right underneath the eyes, and they'll go to an ENT or they'll take Sudafed or something that would relieve that, when in fact it's the blood vessels that are expanding in the nasal passages caused from inflammation of the jaw.
I have to tell you, when I went to my ENT and he told me that it was my jaw pain, I laughed out loud. I thought, are you crazy? My sinuses hurt. So it's just so interesting how everything is really interconnected.
Yeah, it's very cool, and it's absolutely amazing. And we've been using this for about 7 years. And it's amazing when I see patients that really have debilitating headaches and migraines, whether it be every single day that they've just dealt with, or they wake up and take Advil, or to the point that they don't get out of bed for 2 or 3 days, one or 2 days a month. And when we deliver a device that actually, it cuts down basically how hard you can clench, which is this huge muscle, the temporalis muscle, which is directly correlated to migraine activity and headache pain.
So Dr. Hornberg, let me ask you, how often do you wear this? What age is it appropriate for?
Okay, let's talk first a little bit about ages. And typically we don't use it in small children because their teeth are constantly moving, and this does, it's something we take an impression, it's very accurate, the lab makes. So we don't want to lock them into a certain position where their teeth may be moving. So young children will do it typically as a temporary, almost like an acute pain. If they wake up and they're having problems, they'll wear it for a short period of time. Other than like below 12 years old, it's something we can treat everyone, and it's very cool, especially again with people that that are nursing or pregnant mothers where they can't take medications. And this is a non-invasive device. Some of the older patients which are taking numerous medications where they just don't want to add one other thing to their regimen of medications. And what was the other thing you asked me?
You go in and you get impressions made,
Right.
and then eventually this comes out. Do you wear it all the time and just take it out when you eat?
Yes, this is a nocturnal device. What they've shown is most of the pain associated with clenching and migraine pain and tension headache pain is between 1 and 4 in the morning in REM sleep. And so typically this is something they would wear at night, and then it basically relieves that tension that's caused from that clenching, so they wake up not only feeling better, having a great night's sleep, but also not having that pain that's associated with morning headache.
All right, Dr. Hornberg, thank you so much.
Thank you.
NTI, and I know that you're hearing great success stories from people that have tried everything, and this has been an amazing miracle for them. To get in touch with Dr. Hornberg and to try NTI or recommend it to a friend, just give him a call, 619-463-7797, and always great to have you on.
Okay, thank you. It's good to be
Have a
here.
good Monday.
Thank you.
Coming up next.